Good morning. Thank you for coming. I'd like to welcome you to the first official, actually pre-launch symposium about ExoMind. We name it Mind Matters. As you know, BTL is always paying attention, even with the aesthetic treatments, for functionality. And now we see the trend of longevity, medical wellness, and we were thinking what is missing piece of the puzzle. And the actually mental wellness was our goal. So we are more than happy to announce the new era and shifting of paradigm of aesthetics, where we care not only about how our patients look, but also how they feel. With that said, I'm more than happy to welcome our expert panel here, where we are very thankful for you to come and share your experience with the visitors, with the doctors here on IMCAS Congress. The first speaker would be Dr. Louis B. Cady from United States, board-certified psychiatrist, life fellow, American Psychiatric Association, pioneering and integrating the functional neuropsychiatry, and founder of and CEO of a Cady Wellness Institute in Indiana. Very experienced person with the TMS, and I'm very happy to announce that he's having extensive experience with our ExoTMS and ExoMind. And with that said, I'll pass the word to Dr. Cady. Thank you for coming all the way from US.
Thank you, Tomáš. Bonjour, messieurs et mesdames. Je suis très heureux d'être ici avec vous, mes collègues français et internationaux. And good morning, ladies and gentlemen. It's great to be with you. Our focus at Cady Wellness Institute is integrating mind and body for peak performance. That was the foundational keystone aspect of my practice, and that's what we do. To that end, we have integrated ExoMind. The reason I chose ExoMind is that there are some things that you cannot do with the M-Sculpt Neo. You cannot treat this. You need something to deal with the mind, the impulse control center for food craving and addiction. Next. I have always been interested in new technology. So here on the left is an old electroconvulsive therapy device. And in the middle was my first TMS chair that I got some 14 years ago. Next. And so then I integrated ExoMind. And I did it before it was declared in the market. I got a pre-release copy to do some study for BTL. Next. I noticed on the ExoMind that they had the magnets and the cooling, and I thought, gee, wouldn't it be wonderful if that was available for the brain? And then they came out with the ExoMind. Next. So what exactly is ExoMind? It's a repetitive TMS device which was introduced in 2025 with CE marketing, US FDA approval, and Health Canada approval. It's approved in the EU for depression, anxiety, OCD, and binge eating. It's actually cleared in the U.S. by the FDA March 4, 2022 for major depression, but it wasn't announced to the market. And it is used at much lower intensity than the full TMS setting for depression used in psychiatry. And the public product launch was January 15, 2025. Here's the evolution of TMS. Next, you can see where it was invented in '85 by Barker and colleagues, and it continued into 2018, and then BTL released their device in 2025. Go ahead and advance, please. Keep going. Keep going. The benefits noted in aesthetic space are overall mental well-being, decreased binging, improved impulse control, improvements in concentration, and improvements in sleep quality, and those have all been documented. Next. Here are ways to identify appropriate aesthetic patient concerns. In the aesthetic space, this device is not for the diagnosis or treatment of major clinical depression. In the aesthetic space, appropriate patients would be described as down, depressed, anxious, not thinking clearly, Mommy brain, which actually has a French expression. Basically what happens when women get overwhelmed with babies and postpartum. Can't control my appetite. I'm just not happy. I have no energy. I know I look better, but I don't feel better. Loss of optimism. And I really like the Warwick-Edinburgh Mental Wellbeing Scale, and I have used it in my practice. And I will post this presentation online, but there's the link, or you can just go to Google and type in Warwick-Edinburgh Mental Wellbeing Scale.pdf. It's a very useful scale. Next. So the concept of mentally unwell in the U.S., roughly 50 to 60% of the adults in the U.S. could reasonably be described as mentally unwell. Here are the references. It's based on the U.S. Surgeon General Advisory on the Epidemic of Loneliness, the American Psychological Association, the Barna Group on Spiritual Malaise and Loss of Meaning. Next. What about the EU? 46% of EU citizens reported emotional or psychosocial isolation, such as feeling depressed or anxious in the past 12 months. 22% had an increase in loneliness in the EU after COVID-19. Next. So the ExoMind uses gentle magnetic pulses, no drugs. It's effective. There's an aesthetics overlap between this device and aesthetics. Next. Almost anyone can benefit. It offers a more holistic, whole-person approach. And it's noted that the mental state is interconnected with the aesthetic outcome. Since I'm in France, one of the philosophers, Descartes, talked about the mind-body duality. And his idea was that the mind and the body were not connected, and what went on in the mind had nothing to do with the body, and what was going on in the body had nothing to do with the mind. It's called the Cartesian duality. And although I love the French, Descartes was wrong about that. Next. And it's cash-based, which is nice for an aesthetics practice. So we treat the brain as an electrochemical target, and there are different ways to do it. Drugs, psychotherapy, ECT was used for decades. TMS, however, is a focused, non-invasive, and non-systemic treatment for depression, anxiety, and in the aesthetic space, food craving and addiction, and binge eating disorder. We target the lateral prefrontal cortex with magnetic pulses, and I'll show you how we do it. BTL made it ridiculously easy. There's the prefrontal cortex. There's where it's located with the so-called homunculus, this distorted figure that's mapped to the motor strip. And that's the thumb right there. That's where the thumb is located on the cortex. And if we can put our probe on that spot and make the thumb twitch, then we have located where we want to have the device. And I'll show you how easy it is. Next. So this is me setting up a TMS, the ExoMind device. Next. This is the head of the unit. Go ahead and click. Okay. These three dots line up here. Next. You can see them right there. So if you have it there, you have it centered where it's supposed to be. Next. Again. Next. And this is where the magnetic pulses are going to be generated. So it's ridiculously easy to do. You line this up. You put these approximately with the ears, and this is not about cooking. If you were French, you would not be, go back, yeah, keep going. You would not be doing your crepes on high. So there is a setting for the ExoMind where you can do it on high, which would be a psychiatric setting, or medium, which is the aesthetic setting. Next. So the preset 1 is for major depressive disorder, and it's high intensity, 18 minutes, 45 seconds, 30 sessions in the US, and that is at 120% of motor threshold. Motor threshold is how much energy you have to use to make the thumb twitch. Preset 2 is for OCD in psychiatry, and preset 3 here in the EU is the aesthetic clinic settings. It's preset 2 in the US. And that is for binge eating disorder, food craving and impulse control, and the ExoMind wellness-related studies. Next. Okay, this shows the different protocols, 1, 2, 3. Here are the aesthetic settings, 70% of motor threshold, 3 different pulse frequencies, and 6,440 pulses delivered. Next. Here are the 2 settings. Click. This is the setting for full-on TMS treatment for depression. Next. These are the aesthetic settings. It's actually select 3 in the EU. Next. Is it safe? Yes, it is. I searched on transcranial magnetic stimulation. There are 27,498 results. In terms of safety of TMS, 1,540 results as of a recent peer PubMed search on 4 January, and 40 years of clinical use and experience. Here's the most recent paper by Chang and colleagues, The Efficacy and Safety of Repetitive TMS for Comorbid Chronic Low Back Pain. Next. Here's the paper. Next. This is what that was found. Our TMS was highly feasible and acceptable. Excellent session attendance. In other words, people showed up. No participant attrition, no serious adverse events, and additional sleep benefits were noted. Next. Now I want to show you some of these papers that had been done in the aesthetic space. So this was by Michelle Dees and colleagues. This was ExoTMS technology, a breakthrough in transcranial stimulation for enhancing mental well-being. And this was using the Warwick-Edinburgh Mental Well-Being Scale. Next. So there were 33 subjects. Here you can see their characteristics. 35% of them had a diagnosis of major depression, interestingly. Next. And here are the treatments. 4 treatments, 5 to 10 days apart. The main relevant scale was the Warwick-Edinburgh Mental Well-Being Scale. Next. And other metrics were weight satisfaction and therapy comfort surveys. Next. Okay, let's advance. All right, here were the scores. And if you were down here, you had low well-being. And if you were up here, you had high well-being, characterized by strong resilience, positive functioning, and life satisfaction. Next. This is what's very interesting. I wanted to present this to you graphically. So the results at 3-month follow-up. Next. So in terms of low well-being, it dropped by half. In terms of moderate well-being, it decreased. Click again. And the next reason is these people that had moderate well-being ended up with high well-being. So from 15.2% to 50% of the patients ended up with high well-being after 4 treatments, 1 time a week. 4 treatments. Next. Oh, and by the way, this was at 3 months. So here's the last treatment. Here it is at 3 months. The treatment benefit progresses because there have been changes in the brain. Next. This was the numeric analog scale of did it hurt. 0 means not at all. 10 means it was excruciating. The pain level was 0.2. So it's easily tolerated. Next. 77.4% of the patients reported being more focused, having more mental energy after treatments. 87 were in a good mood after the treatments. 80% felt more calm after treatments. And there was no serious adverse events noted. This study I fell in love with after I had already done the study that I was the lead author on. Next. And this is that paper by me and several colleagues, including Rakesh Nanda, and many wonderful people. Next. So again, back to this. The study purpose was, can this device help with appetite and impulse control? Can I give you the quick answer to that? Yes. Okay, next. So it was to evaluate the effect of RTMS on the improvement of self-control and subsequently food cravings. The hypothesis, the left dorsolateral prefrontal cortex, if we stimulate that area of the brain, it will improve self-control. Next. So the hopeful endpoints were that there would be increased behavioral regulation and adoption of a healthier diet. Interestingly, in the informed consent for the study, patients had to sign, no, I will not do anything different in my diet during this study, and no, I will not change anything about my exercise. They had to sign that. Well, as it turned out, many of my patients said, you know, doc, I've really been feeling better, so I'm cleaning up my diet. Or, you know, doc, I just thought I'd get more active, and so I've been walking my dog. So there were developments that organically arose in the context of the treatments. Next. Next. So there were 51 subjects, 39 in the active group, 12 in the sham. The ratings used were the brief control, self-control rating scale, click. The food craving questionnaire, click. Sorry, this isn't working. After the last treatment, 71.4% noted an improvement in the brief self-control rating scale, such as, I wish I had more self-discipline, I have trouble concentrating, I do certain things that are bad for me if they are fun. All of those improved. On the right, the food craving questionnaire, 85.7% improvement. Such things as food cravings invariably make me think of ways to get what I want to eat. I find myself preoccupied with food, and once I start eating, I have trouble stopping. These improved. 85.7% improvement in things like this. Next. So 3 times greater improvement in the brief self-control rating scale and 2.3-fold improvement in the food craving questionnaire. 72% felt improvement in being in control of my everyday diet, which is critical in the aesthetic space. Next. This is even more impressive, perhaps. This is the binge eating study. Click. So here we are at baseline, last treatment, and 1 month after the last time an ExoMind touched their head. So at the last treatment, 63% of people had stopped binging. 1 month later, no treatment, click, 74% had stopped binging. No treatment. There is progressive progress and health in the brain. Next. And I'm going to stop with a clinical anecdote. I want to present Amy. Amy is a 55-year-old Amy was a 55-year-old morbidly obese, depressed white female. She's no longer that way. Her BMI was 42.9. Her chief complaint was, I just want to wake up and be happy. I have a great life, but my brain tells me you don't. Really deep down inside, I'm a sad, fragile person, and I hide a lot. I worry about things that are outside of my control. She had an emotionally traumatic childhood. She's always battled with weight and depressed. Click. Her medications were desvenlafaxine and citalopram, 2 treatments for depression, both of which she's off now. Mixed salts of amphetamine for ADHD and rosuvastatin. Click. So she came in and got 2 ExoMind treatments back to back. That is not a BTL protocol. That's mine. Given the choice between getting a patient better faster or slower, I prefer faster. So she was fully diagnosable with depression and anxiety. Fully. She got 2 treatments. She got an M-Sculpt Neo for her abdomen because she needed the help. And then she came back in a week. All the anxiety and depression diagnosis had been eliminated in 1 week after 2 treatments on ExoMind. On exam, she had only 2 symptoms of anxiety, which is not enough to make the diagnosis, none for depression, and she lost 1.4 kilograms in a week. Next. I gave her 2 more paired ExoMind treatments with the wellness settings. These were not psychiatric settings. These were wellness settings. This is well within the aesthetic space. And I also treated her on the abdomen, and liothyronine and metformin were started. Next. Here is Amy when she came in March 2025. Here she is September of 2025. Next. So I'll tell you a little bit more, and then I'll show you where she is now. Her weight decreased from 124 kilograms to 118 kilograms after 3 paired treatments. BMI dropped. She's still losing weight. No symptoms of depression or anxiety. All standardized rating scales for fatigue and sleepiness were normal. Click. Okay. Here she is in my office a couple of weeks ago. I'm going to take questions later. Pardon me. So this is my last slide. The new paradigm of aesthetics is the inside reflects the outside. And here are a couple of thoughts. From the Dhammapada, all experience is preceded by mind, led by mind, and made by mind. And David Siegel says the integration of the mind creates the foundation for healthy relationships. And I think that's the foundation for ExoMind. Thank you.
Thank you, Sarah, a lot.
I'd like to invite you all for the ribbon cutting ceremony on our booth P210, which is in 15 minutes. Anyway, we are having 5 minutes extra, so we decided to improvise a bit. There were a few hands raising up for questions, so I will hold the microphone to my colleague. If you want to ask questions, we're just about 4.5 minutes to do so.
Hello, thank you for the nice lecture. I want to ask you about the sessions. How many sessions do you recommend for patients? And the other question, if you allow me for 2 questions, I have tried 1 session, and after that, I keep crying for 2 days. I don't know why.
Thank you for both of those questions. How many sessions for patients? It varies. I have a psychiatric practice, so sometimes I have some seriously depressed and impacted patients. And I will start, as I said, this is not BTL policy. The wellness is 2 treatments a week for 3 weeks, 6 treatments. It sounds ridiculously easy and simple, and one wonders how could there possibly be impact in only 6 treatments, but there is. For me, I have after I did that with Amy, and Amy was one of the first patients that I really treated outside of the study protocol. And when I did those two treatments back to back and saw that in terms of diagnosable depression and anxiety, it was gone in a week, I thought this is really something. So that's the way I'm going to do it. So I have had, and Amy has had a total of 6, 2 a week for 3 weeks, and she started slipping, and she came back and got 2 more, and that's it. In terms of crying for some time after you had a treatment, I am going to answer that as what we in the U.S. colloquially call a shrink, a psychiatrist. And I don't know you, I don't know your background, but sometimes ExoMind can kind of dynamite the cobwebs out of the psyche. And if you have things that are bothering you on an unconscious level, perhaps they were bubbling up. The brain reorganizes after the treatment. So that might be it. I would continue. The question is, should I continue the sessions? I personally would. You might ask your aesthetics practitioner to lower the intensity of the setting for the treatment. Your own doctor? Okay. So I'll answer that, and then I need to be respectful for my colleagues. I would dial down the intensity that you're using. So the motor threshold, if it takes, if you're at 80 for the motor threshold, 70, I would dial it down to where you're treating. So that's the treatment, that's the motor threshold, but instead of 100% of that, I'd pull it down and do less. Those are excellent questions. Thank you.
Thank you so much. Thank you so much, Professor Lewis. I have 2 quick questions. The first one about Amy. Why did you treat her with metformin and thyroid hormone if she was doing well on ExoMind? And my second question, are you doing MRI or MRA before the sessions for each treatment? And what are the contraindications, the absolute and the relative ones? Thank you.
Okay, I want to go, I didn't quite understand all of this. I want to go through those one by one. So just one question and let me answer it.
Okay, for Amy, why did you treat her with metformin and thyroid hormone if she was doing very well on ExoMind?
I didn't treat her with growth hormone.
Not growth hormone, thyroid hormone.
Oh, thyroid hormone.
Yes, and
because her
metformin.
thyroid functions were not optimized.
Okay.
So I'm a wellness clinic, so I focus on making sure that the free T3 is at an optimum level. In the U.S., the notion is check TSH and treat with T4. It's an antiquated notion, and when I'm examining thyroid axis, I'll look at TSH, free T4, free T3, and reverse T3. That's the reason. She needed the free T3. That's one of the reasons she had gained all the weight.
Right.
Okay, next question.
Next one, what are the absolute and relative contraindication for the ExoMind? And are you doing MRI or MRA before the sessions to see if they have tumors, aneurysm?
Okay, the absolute contraindications for ExoMind for treating for depression with an FDA-approved protocol of 30 treatments would be mania. It can, or bipolar disorder. It can make it worse. But in terms of the aesthetic space, which is using less of a setting, I would say if somebody is really anxious and on edge and says, I haven't been sleeping for 2 days and I've been spending all this money, classic symptoms of a bipolar manic or hypomanic episode, then I would refer to a psychiatric colleague.
MRI, MRA.
I don't need MRI or MRA before I do it. It is ridiculously easy to set it up. There is no, in terms of TMS, there is no demand by the FDA for imaging studies to rule out a tumor before one uses TMS.
Okay. What about cochlear implant?
I would not use. That's metal in the head.
Okay.
BTL would lose it if you were to do that. No,
Thank
I
you.
would not do that.
If I may give you the company standpoint, there's a list of contraindications like with every device on the manual. No need of pre-screening by any device. Of course, it's a medical device. You should get the patient anamnesis properly. And the indications and the dedication of the device is for the aesthetic medical approach to the mental wellness, for the binge eating. And because Dr. Cady is psychiatrist, he's using the psychiatry options with the device as well. Primary approach is the wellness. Thank you.
I was just going to second that, Thomas. So we're not looking to treat mental health. We're looking to treat mental well-being, wellness, longevity. All of our patients come in and have an hour-long consultation with my medical lead. A full medical history and screening's done. Questionnaires are done. We assess their suitability. Pregnancy, obviously we wouldn't go near pregnancy. Active cancers, metal being the big one. Pacemakers, wouldn't touch those. But we're not looking to treat the mentally unwell. We're looking at mental wellness and longevity.
Thank you, Sarah. Yeah. Totally. There's a saying, you can take the country out of the girl, but you can't take the girl out of the country in the U.S. or things like that. I can't take the shrink out of me. So when I see somebody that's coming in for aesthetics and they're depressed and anxious, I think, okay. And that was aesthetic settings that I was using, not psychiatric.
I'm really sorry to do that, but our time is up. I very much welcome you to our booth, 210. Thank you for coming. And thank you.